As we know, LDL is the cause of atherosclerosis. Numerous studies, genetic studies, epidemiological studies, and interventional studies have proven that. So there's no question about that. It has also been shown that once we lower LDL-C, the ASCVD event rates decrease. It's been found that each 1 millimole per liter reduction in LDL-C, which is roughly 39 milligram per deciliter, this much reduction in LDL is associated with 21% relative reduction in the risk of atherosclerotic vascular events. Now, the interesting thing is that this risk reduction is constant regardless of the patient population, regardless of the baseline LDL cholesterol, and regardless of the modality that we are using for LDL cholesterol. So all patients will get 21% reduction in the vascular events if we reduce LDL cholesterol by 39 milligram per deciliter from whatever value we have, which means that person whose baseline risk is high, they will derive greater benefit because relative risk reduction is same. That means that the patients with the highest risk will get the maximum benefit. And this is what the guidelines also recommend, that in highest risk individuals, we should lower LDL to less than 50 milligram per deciliter at least. This is what the LAI guidelines recommend. LAI meaning Lipid Association of India. CSI and European guidelines recommend less than 55 for most of the patients with ASCVD. But within this population also, those who are at higher risk, like recurrent vascular events, patients with polyvascular disease, patients with diabetes, ASCVD, and other risk factors, in them, the LAI recommends a target of less than 30, and European guidelines recommend a target of less than 40 milligram per deciliter. But this is also not enough. We can reduce LDL to any level. We can go down up to 10 milligram per deciliter also, and there will be incremental benefit. So, which means that there's no bottom line for lowering LDL cholesterol. Lower is better, and lower levels become the targets become lower and lower as the risk becomes higher and higher. Now, regarding the mortality benefit, so there is something that we need to understand, that when the baseline LDL cholesterol is high, then when we reduce LDL cholesterol, we get mortality benefit. But once we come down to low LDL cholesterol levels like 50, 60, 40 milligram per deciliter, if we reduce LDL cholesterol further, we will be able to reduce the risk of myocardial infarctions and other vascular events, but mortality benefit may not be seen at those levels. Patients who are at the highest risk of having vascular events, they need to achieve LDL cholesterol, have a very low LDL cholesterol levels, and they get maximum benefit if we lower LDL cholesterol. So that is the population in which all these intensive LDL cholesterol reducing agents are recommended, like inclisiran or even PCSK9 inhibitor. So all patients who have got ASCVD, especially the high risk ASCVD like recurrent vascular events, polyvascular disease, in them, if you are not able to reach the LDL target with maximum tolerated oral lipid lowering therapy, which includes statin, ezetimibe, and bempedoic acid. So if we are using maximum tolerated doses of these three agents and we are not able to reach LDL cholesterol target, then these are the patients in whom inclisiran is recommended. The other population in which inclisiran is recommended is heterozygous familial hypercholesterolemia, because that is a condition in which LDL cholesterol levels are quite elevated, and these are the patients who are at very high risk of having adverse vascular events because of malignant atherosclerosis. So these are the two main groups in which inclisiran is currently recommended. Inclisiran is recommended as injections. We administer 284 milligram dose per injection, and the regime is that we administer first injection at 0 day, then the next injection at 3 months, and then subsequent injections at 6 months interval. This is the dosing regime which is recommended for inclisiran. Who've got a high risk vascular disease like recurrent ASCVD events, polyvascular disease, or patients with heterozygous familial hypercholesterolemia, and So these are the patients in whom we will consider inclisiran-like therapies. If the desired LDL level, LDL cholesterol level is not reachable with the maximum tolerated oral lipid-lowering therapy. So that's the primary group. Now, there are patients who have got other high-risk conditions like strong family history of premature CVD. In them, also we would target very low LDL cholesterol levels. And there, if the patients are not able to reach LDL goals with oral agents, then one might consider using inclisiran. Guidelines recommend that. Lipid Association of India recommends inclisiran and other agents in all high risk conditions where targets are not reachable. But here we would need to have good discussion with the patient and family, and we need to discuss all the pros and cons, and then have to have a shared decision regarding this. Okay, so regarding long-term safety, I believe we've got data up to 7 years with inclisiran, and that data has not shown any adverse side effects with inclisiran except for initial injection site reaction when the injection is administered. But apart from that, there is no risk of using inclisiran. And when we use inclisiran, we expect the LDL cholesterol level to go down to very low levels. So there is no safety concerns regarding that also. Studies with other agents have shown that even with 10 milligram per deciliter LDL cholesterol, there is no risk of any serious side effect as compared to placebo. So there is no reason to be apprehensive of any side effect when we are using inclisiran except for injection site reactions. Inclisiran has been studied in few randomized clinical trials, like in patients with heterozygous familial hypercholesterolemia, in ASCVD population also. But these have been relatively short-term studies, like 1.5 years. These studies have shown that inclisiran is safe, reduces LDL cholesterol by roughly 50% from the baseline, and exploratory analysis from these studies have shown that inclisiran also reduces cardiac events, MACE. But actual outcome studies are currently underway. There are two large studies which are going to be released next year and next to next year. They will have a final answer. They will give a final answer regarding the overall impact of inclisiran on cardiovascular outcomes when we are using them for lipid lowering.